Hello, we are the faculty from Seminole State College of Florida Physical Therapist Assistant Program, and we're here today to tell you about physical therapy and the role of the physical therapist assistant, as well as the program at Seminole State College of Florida. Today we have Dr. Jeff Miller, Mr. Patrick Lambeth, and myself, I'm Dr. Jamie Brickley. We're going to start by having Dr. Miller tell us a little bit about the professional associations and the profession of physical therapist assistant.
Good morning. We're going to look at number one, the Commission on Accreditation in Physical Therapy Education, and they are responsible for governing and accrediting all physical therapy and physical therapist assistant programs nationally. Once we look at their website and web presence, we're going to move to the American Physical Therapy Association as well as the Florida Physical Therapy Association. These are wonderful resources for you as you're exploring both the profession, trying to decide if it's a good match for you, and then if you do make that decision, they're great resources for determining where you're going to attend. So this is the CAPTI website. Again, CAPTI is the Commission on Accreditation in Physical Therapy Education. They're responsible for overseeing all PT and PTA programs. I would strongly encourage you to visit captionline.org as you're exploring different options for programs. From their landing page, on the right side, there's this quick links program. And if you go down here to the directory of programs, you'll be able to look at all accredited, developing, and bridge programs nationally. So just so that you see how this works, we're going to look at accredited PTA programs, and it'll pull up a map of the country. And if you want to look at PT programs, click this button, PTA programs, click that button, and it pulls up a map of each state. And so if we just look at PTA programs within Florida, you'll have a listing of every program, their contact information, their location, and their accreditation status. So we'll scroll down to our program's information. You see that the Seminole State College program is in Altamont Springs, and there's my contact information there. We were initially accredited in 1993, most recently in 2018, and you see we are presently accredited through 2028. So, as you're considering different programs, I would strongly encourage you to check their accreditation status. If they've got current accreditation, that's a good sign. If they're on probation, you may want to inquire as to why. But also, if you're looking at going to school in one particular state or region of the country, that allows you to narrow your search to programs that are there. Before we move on from CAPTI, I want to just take a moment and be certain that neither one of my colleagues have anything to add to that. Okay. So another great resource for you is the American Physical Therapy Association's webpage. And this can be found at apta.org. And this is the webpage for our professional association. And so the APTA represents all physical therapists and physical therapist assistants nationally. And if you're just trying to decide if this is going to be a good fit for you, there's a tremendous amount of information located in this webpage. But I want to call your attention specifically to one section of it on becoming a PTA. And here, a lot of the commonly asked questions can be answered. For example, what do physical therapist assistants do? Where do they work? If you're watching this video, you're probably wondering how much PTAs earn. And you'll see there that the median income is about $52,000. Again, that does vary based upon geographic location, years of experience, and practice setting. But there's a lot of wonderful information, and I don't think it's a good use of your time for me to read it to you. But if you're seriously entertaining the profession, go ahead and take a moment and look at the APTA's website. And so while the APTA governs the entire profession, the Florida chapter, the FPTA, represents Florida physical therapists and physical therapist assistants. And the Florida chapter is responsible for trying to drive Practice Act legislation in the state of Florida. So the next page I just want to call your attention to is the FPTAs. And this can be found at fpta.org. And right now, one of the health concerns we're seeing nationally is, I'm going to stop sharing so I can talk to everybody's face for a moment. One of the health concerns we're seeing nationally is the very significant prescription and abuse of opioid drugs. And so FPTA has partnered with the APTA and tried to make physical therapy a more publicly known and recognized alternative to prescription medication and opioids. So there's an entire section of the FPTA's webpage called PT for Pain. And this is a wonderful outward-facing or public-facing webpage talking about how PT can be an effective alternative to manage pain. And right now, I think this is one of the very current issues in healthcare, and it's something that our association is taking seriously and trying to make progress with. So I think that covers all of the really important governing bodies. Again, CAPTI, the APTA, and FPTA. One more time, those websites are CAPTIonline.org. That's CAPTE online.org, APTA.org, and FPTA.org. I'm going to turn it back over to Dr. Brickley.
Okay, and now we are going to talk to Mr. Lambeth. So Mr. Lambeth, I think everyone would like to know what led you to choose the field of physical therapist assistant for your career.
Well, when you talk to our students, the common response is that you had a previous session of physical therapy yourself for an injury as a young man or a young woman. And I did have one of those, a brief time in therapy for a sprained ankle. But I can't claim that that's what inspired me. I had the therapy and I just moved on with my life and didn't really think about it until later in school. I was aimlessly wandering around college and happened to hear about it. I didn't know anybody who did it. And so I'm going to have to claim some sort of divine intervention. I'm not really sure how, because I had always, the therapists that I had seen were these type A, bubbly, life of the party people. And I don't consider myself that in any way. And my colleagues can probably attest to that too. So I thought that was a profession that wasn't fit for me. But I am here to tell you that they need introverts in this profession, of which I consider myself one. I never thought I'd be talking for a living. I thought I might be in a cubicle somewhere my whole life, but there is a place for you if you don't feel like you are the outgoing type. Let's put it that way. So I got lucky, and I'm so happy that I did choose this profession, and it's been a wonderful 25 years now.
Wow, that's awesome. What characteristics do you think are required or necessary for this profession?
So, not being a social butterfly doesn't disqualify you from this profession, but having a one-on-one rapport that is easy with patients is important. The patient needs to trust you. You need to have an easygoing and organized way about you. I believe organization is important. Being able to adapt to your surroundings. It is not, your day rarely goes exactly how you think it's going to go. So being adaptable is important as well. Being able to prevent yourself from being frustrated easily is important as well. But I've found joy in each area that I've worked in, and you can find good things of it every day. Every day you can come away with something that you're happy or proud about, if you just forget the things that frustrate you sometimes. But that's every job, probably.
What have you found to be the most fulfilling about your career as a PTA?
Well, of course, I like the outcomes of the patients and to seeing the progress that people make and the improvement in the quality of life. But I've also been very lucky to have terrific coworkers almost everywhere I've been. There's nothing like knowing, if you anticipate a difficult day, that almost everybody that you work with is on your side and is willing to help. And it just seems to draw that type of person to this profession. And I really appreciate that as much as I love the patients, I really like my coworkers as well.
Is there anything else that you'd like to tell us about your experience as a PTA?
Well, I've worked in every setting except a nursing home so far. So that's home care, that's acute care in the hospital, wound care, outpatient, and subacute settings, which is a step down from the hospital. And I haven't done pediatrics, let's add that too. So those can be very different areas that I have found something to enjoy in each of them. I think my favorite is, well, it's obviously this job right now, but I like outpatient as well. The reward to me is a little more acute. So I do like that I have experience in other areas. It does give me a more perspective about where a patient has come from or where they are going, depending on where I am. So you'll find a niche that when you get into school or when you get to clinicals or observation, that will help you determine what your love might be, but don't rule anything out. You might be surprised how you like an area that you didn't think you would like. So I enjoyed most of them. Yes. Awesome. The variety.
Thank you. So as Mr. Lambeth mentioned, there's a lot of different settings that you can work in as a PTA. You can work in a hospital, and within the hospital, there are so many different types of areas. You could be in ICU, you could be in a post-operative unit. You can work in pediatrics, you can work with more elderly people in a long-term care facility or a skilled nursing facility, an inpatient rehab facility. You can work in outpatient, you can work with athletes or non-athletes. You can do wound care, so caring for people with pretty severe pressure injuries or incisions that are not healing well and that sort of thing. You can work with vestibular issues for people that are having problems with dizziness or falls. So the wonderful thing I think about the profession is that if you get kind of tired of one area, you can move on to the next. And actually among the three of us, I think we've all had times that we've spent in different settings. And I'd like to show you some short little video clips of different settings of physical therapy, but I wonder if Dr. Miller would like to share some of the settings that he's worked in or a little bit about his experiences.
Certainly. Just like Mr. Lambeth, I've worked in a number of different settings. I began as a student, I guess I should start there, and had the opportunity to treat pediatrics. And initially, when I went into that setting, I thought I was going to make a career of pediatrics. And after doing one of my clinical experiences there, decided that that wasn't the best match for me. So like Dr. Berkeley mentioned, even within a hospital setting, there's a lot of different floors you can work in. And I was placed in the trauma floor. Incidentally, it was the only level 1 trauma center in the northwest part of Florida. And so we saw a lot of motor vehicle, motorcycle, and boating accidents. And so I went from pediatrics to trauma to inpatient rehab was my 3rd setting as a student, and then outpatient was my 4th setting just as a student. And so I had a wide variety of experiences before I took my first job as a clinician. And I worked in outpatient for a while, and then I moved from outpatient to home care. And home care is a really novel environment. You see, I think people at their best and at their worst, sometimes all within the same visit, but it is very much a rewarding setting to be able to help people within the context of their home. From home care, I went into inpatient rehab. And so aside of wounds, I think I've experienced most every setting. And then I've worked, obviously, in my current role in education. So.
Okay, thank you for sharing that. So I'm going to show, the first video I want to show is actually in an ICU setting, so intensive care setting. This patient's actually on a ventilator while he's doing physical therapy, which is kind of interesting. I worked in ICU setting for about 10 years, and it's incredible. You definitely get to use your mind and the knowledge of the organ systems of the body, and really have to pay attention to what's going on with the whole patient. And you'll see in this video there's a lot of medical lines, and the evaluation's already been done, and now the interventions are being completed. And so all the things that you see in these videos will be things that physical therapist assistants can do. So I'm going to go ahead and play the video. And so this is a part of an assessment of the patient's strength, and it can also be used as an exercise. And now you can see that the clinician is listening to breath sounds and monitoring the oxygen levels of the patient. And they're going to monitor the heart rhythm. And now this is so incredible. The most incredible thing I think about working in the ICU is to get the patient standing again. And it's especially fun if the family is there to see it, because a lot of times these patients were very close to death. And so to be able to see them stand again, I think gives such renewed hope both to the patient and the family members. And so you can see this person's actually doing therapeutic exercises on a ventilator with multiple chest tubes, multiple lines. He's actually doing mini squats. So that's one of the really incredible things that you could do as a PTA. I'll show you another little video clip that shows another type of therapy that you could pursue, and this is spinal cord injury therapy. So this is a young person who's suffered a recent spinal cord injury. And you can see some of the really incredible therapy activities that you can do with the patient, so that we can really have a lot of fun in physical therapy. And I think it might be fun too for you to see some progression. And so here you can see that the patient's actually progressed to assisted standing. Now, it's not realistic that he's ever going to probably really be able to stand on his own because of the leg weakness in a functional standpoint, but it is important for bone density and muscle tone. And so it's very fulfilling to help a patient to do something, again, that they didn't think they were going to be able to do. And so I hope that you will pursue this field, because I truly believe that it's an awesome profession. And Dr. Miller is going to talk to us a little bit more about the program here at Seminole State College of Florida.
So if after this video and further exploring the profession, you decide that you want to consider Seminole State College's program, I want to give you a couple of good resources for information and a place to answer most of your questions. So the first place I would encourage you to go is the PTA landing page of the college's website. And this can be found at seminolestate.edu/PTA. And this is going to be the landing page for a lot of our information. So there's a few things I want to highlight. Number one, toward the bottom, you see the handbook. And the handbook is intended to be viewed virtually. And I want to call your attention to a few things that prospective students generally inquire about. Number one, the application and admission process. And number two, the estimated costs. So the application and admission process is detailed right here. And I would encourage you to read that in its entirety if you're exploring our program. But briefly, we look at three different areas. Number one, your GPA, specifically within the 7 general education courses we have. Number two, the TEAS exam, which is the test of essential academic skills. And then number three, observation hours. And if you're watching this this year during COVID, we have made some changes for observation hours being a challenge. But in subsequent years, we intend to return to our observation hours requirement. So would encourage you, number one, to read this section. And then number two, program costs can be found on the next page of the handbook. And you'll see that tuition for in-state students is right there at $7,700. And if you look at all of the other costs associated with the program, an in-state student can expect to spend just over $11,000 on their total program costs. And so that's the handbook. Again, a lot of frequently asked questions. One more item on the website that I just want to call your attention to. This is going to be present on every program's website. It's one of our accreditation requirements. You should see from any program their outcomes, and you can see our program outcomes from the last several years right there. One of our accreditation requirements is that we publish that data so that prospective students can make an educated decision as to what program they want to explore. And so data that I would encourage you to compare program to program include the graduation rate, the national board exam pass rate, and employment rate. Dr. Brickley, did you want to add anything to that?
Just that I think it's a great return on investment and a great field.
Absolutely, yes.
All right, well, we hope that some of you will consider the field of physical therapist assistant and the program here at Seminole State College of Florida. That's all for now.